Yes, as he just mentioned, that we would like to take this gathering as an opportunity to have a very special event, Master of the Masters. Yes, we've held a Master of the Masters where to acknowledge those who have made remarkable contributions to field of interventional cardiology and bestow the word to our outstanding experts. Dr. Seung-Jung Park will be announcing it to us with a very special presentation. We would like to invite Dr. Park once again to the stage.
Thank you again. All right. Welcome to the 15th TCTAP Masters Award on the 30th anniversary of TCTAP. Every year, it is a great joy for me to present this award. Since 2011, the TCTAP Masters Award has been presented to the honor the remarkable experts who have been making meaningful contribution to the field of interventional cardiology and to the growth of TCTAP. And here our past 14 masters, whom I would like to extend my genius appreciation for their expertise and dedication. Spencer, Eberhard, David Holmes, and last three, Nico Pills, you know that Alan Cribier is a very good friend. So this year's winner is the kind of person. She is a world-renowned trialist, researcher, but she always lifts up others and stand by us as a caring friend. So let us watch a special video to find out who is the winner of the 15th TCTAP Master of Masters Award. Thank you.
1962, in the vibrant city of Tehran, a young dreamer envisioned a future where she could make a difference by healing both bodies and hearts. With a deep passion for helping those in need, she moved to the United States at the age of 13, beginning her journey toward mastery. Drawn to the complexities of heart disease, she recognized the urgent need for improved treatments. This realization has led the master to specialize in interventional cardiology. By advancing her expertise at renowned institutions in Connecticut and New York. Today, the master serves as the director of the Women's Heart and Vascular Center at Mount Sinai Fuster Heart Hospital and vice president of the ACC. She's also been an active contributor at TCTAP for nearly 2 decades, sharing her expertise with global attendees. As a trailblazer, her unwavering dedication and innovative approach continue to redefine patient care, improving lives around the world. Dr. Roxana Mehran is a pioneering trialist and clinical researcher whose groundbreaking work has reshaped cardiovascular medicine. With over 2,000 peer-reviewed articles to her name, she has advanced the field's understanding of risk assessment and disease prediction.
Dear Roxana, congratulations on receiving the 15th TCTAP Masters Award, especially on this special 30th anniversary TCTAP. I still vividly remember the moment when you first walked into the cath lab at Asa Medical Center 25 years ago, greeting everyone with your warm smile. I have been fortunate to witness your incredible journey, also as a cardiologist and as a champion for women in medicine. Your hard work in advancing heart care is truly remarkable, but equally inspiring is your leadership is breaking down the barriers and creating more opportunities for women. Thank you for everything you have done for this field and for your vital role in shaping TCTAP in what it is today.
As a founding member of the Cardiovascular Research Foundation, Dr. Mehran's visionary approach has been profoundly influenced by the guidance of her close mentors, whose support has been integral to her ongoing impact on the field.
I've known Roxana for more than 35 years. She is the person in the world who has helped to identify and help to correct the gender balance in the workforce in interventional cardiovascular medicine. She's now extended her career and has become an international rock star in education, communication, and clinical investigation in all subjects relating to interventional cardiology, and in particular to some of the new age pharmacology. Warm, sincere, and indescribable work ethic, has mentored hundreds of cardiology fellows, and is the kind of person that best symbolizes this important award.
Most of you know Roxana, but what most of you do not know is that Roxana was one of my first intravascular imaging fellows soon after I joined the Cardiovascular Research Foundation more than 30 years ago. She has forged her own way and on her own terms, focusing on clinical trials, promoting women in interventional cardiology, and in a year's time, the presidency of the American College of Cardiology. I could not be more proud of a former fellow who I'm honored to call a friend and a colleague.
Today, I cannot count how many difficult fields in interventional cardiology you have clarified by simple, pragmatic, clear categories generated by your clear mind. From these early days, creating art together, you have never ceased to impress us by your energy and clarity of view. Therefore, you absolutely belong to the top leader club.
Her research focuses on coronary artery disease, myocardial infarction, and women's cardiovascular health, areas where her contributions continue to drive new strategies and improve patient care.
Your influence on the field of interventional cardiology, and specifically so many trainees, so many women trainees, but not just the women, really everybody, is something that really can't even be quantified. And I just am so, I don't even know what to say in terms of the word, thrilled that I got to meet you, and you took me under your wing, and I'm forever indebted to it, and your family. So thanks for everything, and congratulations, sincerest congratulations for this deserved award.
Master of the Masters by the TCT Asia Pacific, an organization that you helped over the years tremendously from the get-go. Because you wear many hats, have many great roles, you recognized everywhere just by your first name. Warmest congratulations, tremendous achievements, and congratulations to the organizers of TCT Asia Pacific for such an incredible selection for this year's honoree.
Dr. Roxana Mehran is also widely recognized as a passionate advocate for women's elevation in interventional cardiology. In 2018, she was honored with the prestigious Wenger Award for Excellence in Medical Leadership from the legendary icon Dr. Nanette Wenger. Continuing her legacy, she co-founded Women as One, a global initiative dedicated to empowering female clinicians by promoting leadership and creating opportunities for their growth in the field.
She is also extremely generous. Through her work with Women as One, for example, she has transformed the career and mindset of many women doctors, making a lasting impact on the medical community. When she truly believes in a just cause, she is unstoppable, like a bulldozer in the jungle, forging a path forward without letting obstacles stand in her way. Dear Roxana, I'm so happy that you are receiving this honor. No one deserves it more than you.
Dr. Roxana Mehran is more than a researcher. She's a visionary and path-breaking leader who has transformed the landscape of healthcare. Her passion has also inspired her daughter to follow in those footsteps, exploring new frontiers in cardiovascular science. Dr. Mehran's legacy resonates like a steady heartbeat, making a meaningful difference in countless lives through her contributions.
Congratulations, this year's Master of Masters goes to Dr. Roxana Mehran. Ladies and gentlemen, please let's give her heartfelt round of applause. Congratulations. And also Dr. Seung-Jung will present the award. Congratulations. Your dedication is what enabled the heart beat strong once again. We would like to invite you all at the center of the stage, and Dr. Park will present the award. Let's give her a big round of applause to celebrate this moment. Congratulations. And also, we will take a commemorative photograph together. Please also warmly bless their long friendship. Congratulations once again. Thank you very much. We would like to sincerely thank you for your noble dedication and sacrifice. Thank you. And also, Dr. Roxana Mehran will take the mic for her special presentation. And before that, could you please share with us your feelings just standing here with our all cardiologists, please?
First of all, what an incredible occasion to be here with you today, and I'm incredibly humbled and really shaken by that beautiful video of my life flashed in front of all of you. But most importantly, I want to thank TCT Asia Pacific and its founder, Professor S.J. Park, Dr. Park as well, DW, you've been amazing. But most importantly, and also very much, my mentors, those who brought me to the stage, those who gave me the opportunity to be where I am today. And noteworthy, the most important one is sitting right there, Martin B. Leon. Thank you. Thank you for giving me the stage. Thank you for never, ever standing in front of me and taking the light away, but also shining the light. You gave me the stage, the opportunity, and the incredible platform through the Cardiovascular Research Foundation to begin my journey in the field of interventional cardiology. I couldn't have been more lucky to have met you and to have had you in my life. Thank you. Thank you so much. Interestingly enough, it is about 30 years since I came to practice interventional cardiology and to be in at CRF meeting with Marty Leon, but that led me to a journey that has been incredibly beautiful, difficult at times, but often incredibly rewarding. And that is what I want to give back to everyone, is to say that whenever you achieve something, know that there is responsibility in lifting and making sure that you recognize others just the way Marty Leon recognized me and set me through my path. I must say the Asan Medical Center is one of the best cath labs I ever worked in, and the embrace from that group, that team, the ability to be there on stage so early in my career, given the opportunity to perform left main intervention with the best operator in the world at the time for left main intervention, which was S.J. Park, is really something unimaginable. And that is how I set forth in my first steps in my journey. So thank you, and I'm really, really moved by this. I don't get this nervous, but this really is an incredible recognition by TCT Asia Pacific. I know that the next 30 years will be extremely strong. So I thought I would take you through a little bit of a crossroads of where we are and the opportunity that we have to enhance and make our interventions incredibly durable and improve human health. Cardiovascular disease, after all, is the #1 killer of men and women, and we're all devoted to that for all that we do in making sure that our patients are given the opportunity for intervention, but also for prevention of recurrence after our interventions, and maybe even perhaps reducing the need for severe interventions as we are seeing. So I thought today I would take you through some of this important tale of coronary artery disease and myocardial infarction, and to imagine where we were 4 decades ago and where we're heading and what the future holds for us. There's been this tremendous decline in cardiovascular morbidity and mortality. And how did we get there? And what was the impact of this group, interventional cardiologists, especially through percutaneous coronary intervention? And who knows what we've done and how the impact of transcatheter aortic valve and transcatheter mitral and tricuspid valves and structural interventions will do. But let me take you through these last 40 years. We began with Andreas Grunzig. He was the one who basically showed us the way with his discovery of percutaneous coronary intervention, the very first balloon angioplasty. But let's not forget about Cindy Grimes and her work in acute MI and putting PCI right in front in terms of primary PCI that actually made one of the most important contributions in reducing cardiovascular morbidity and mortality. Primary PCI for acute coronary syndromes now. But Patrick Sorois and Marty Leon led the way with devices, specifically with stents and drug-eluting stents, where we are today and how we have reduced the major adverse cardiovascular events based on the work that they had done and pioneered. But it was Marty Leon and, of course, through some of the work that was done by pioneers like Marie-Claude Maurice and Antonio Colombo, where they really figured out what to do in terms of antiplatelet regimens after stenting. And Marie-Claude Maurice, once again, coming forth with the very first drug-eluting stent work with the work of the Ravel study we all remember so well. And S.J. Park and his colleagues pushing that to the limit of going to the left main, CABG versus PCI for a left main PCI, and that important randomized clinical trial, pre-combat, that was published in the New England Journal of Medicine by his team. But modern PCI is now about what we saw today, intravascular imaging, new generation drug-eluting stents, and all of the things you see listed here. And Korea has been front and center, especially Asan Medical Center and the group at TCT Asia Pacific, for the work that they have done. But a lot of this work stemmed from one man who also taught me, Gary Mintz. He, with his vision of intravascular imaging, understanding the mechanisms and giving me the opportunity to actually push forward, imagine this would happen, that one day we would have class 1 indication, and we now have achieved it in 2025 guidelines. But how do we optimize our outcomes? How do we go from intervention to prevention? We know we don't stop right there. And I think there's no question that patients at high risk for atherosclerotic cardiovascular disease still have very important residual risks that need to be evaluated and dealt with. Cholesterol, inflammatory, thrombotic, triglyceride, genetic, and diabetes and obesity. And for us, it's always been about the antiplatelet therapy remaining the cornerstone of antithrombotic regimens after acute coronary syndromes and percutaneous coronary intervention, and finding that sweet spot where we could balance ischemic and bleeding complications in a way that just doesn't approach that 1 millimeter or a few millimeters of coronary artery stent procedures, but what's going on outside of the stent, plaque progression, prevention of systemic events, ischemic events, and preventing and minimizing the bleeding harm, finding that sweet spot. And over the years, you see Korea once again leading the pack in multitudes of clinical trials in modulating dual antiplatelet therapy regimens, and certainly through the work that has been done in Asia specifically, but also around the globe, we are now thinking about a shorter duration of dual antiplatelet therapy and perhaps going to a monotherapy with P2Y12 inhibition, specifically with ticagrelor, which started with global leaders and Patrick Sorois, Marco Valgemigli, Stefan Windecker, who led the path, and then we followed. And now we have individual patient data meta-analysis that shows with ticagrelor monotherapy, you could reduce bleeding tremendously without any increase in ischemic harm. And this was sort of a very interesting idea, that is this conclusive evidence for ticagrelor monotherapy in acute coronary syndromes, which for the very first time in 2025 guidelines became a class 1A indication for patients. And now we are still trying to find what is that short duration. And Professor Kim and his colleagues with the HOST BR study showed in ACC 2025, 5,000 patients, telling us that perhaps it's not one size fits all, and maybe the 3 months regimen is the best way forward, because 1 month may not work for everyone, and it may very well be the 3 months that could give us that perfect balance. And in fact, it is again our Korean investigators working very hard to figure out what should be the chronic maintenance. Should it be P2Y12 monotherapy with clopidogrel or aspirin? And they're showing us perhaps maybe that is the way to go, although we want to see larger, more global studies to show us this, especially because the HOST exam study did show that clopidogrel was superior in terms of the major adverse cardiovascular and bleeding events. But the idea of uncoupling thrombosis and hemostasis is one that is not far away from us. In fact, we are thinking about exploring factor 11, where we believe inhibition reduces formation of the pathologic thrombi with hypothesized preserved clotting response to bleeding, this novel factor 11 and 11A inhibitors. And in fact, J&J is taking on this huge, large program with Librexia, with over 50,000 patients with stroke, atrial fibrillation, and acute coronary syndromes to address this, and the future will be very, very bright. But beyond antiplatelet therapy, let us not forget that our patients can be protected if we think about their lipids, their inflammation, and maybe Lp(a), even so for cardiovascular risk. This is the data from Paul Ritker's work that tells you that reducing cholesterol is LDL cholesterol, extremely important, but also reducing inflammation and Lp(a) also very, very much correlated with adverse events. And in fact, now we are at a place that the lower you go with your LDL, the better you will be. And our guidelines are telling us now below 50, not 70, is where we should be going. The effects on plaques with PCSK9 inhibitors, these injectables, are tremendous, thickening that thin fibrous atheroma and reducing the LCBI and the content of the fat with alirocumab in myocardial infarction. In the non-infarct related artery, we heard that today. This is really tremendous, not only in just lowering LDL, but also transforming an unstable plaque to perhaps a stable one. And in fact, there is a very large EVOLVE-MI trial that will inject patients at the time of MI, which is ongoing, completed its enrollment, and we will see evolocumab versus routine clinical practice in reducing those events. And in fact, there are other new perspectives in terms of small interfering RNA with inclisiran, where the Orion 4 trial, as well as Victorion 1 for primary prevention and secondary prevention, are nearing their ability to read out. These outcome trials will have about 40,000 patients, which have both primary and secondary prevention on the docket to show us that there could be reduction of these. And we are just beginning a V intervention study where all intervention, PAD and CAD intervention, will be met at before hospital discharge with inclisiran versus placebo. Very exciting future. Lp(a) is another one. Let's not forget its association with aortic stenosis. It should be measured at least once, and if you haven't measured it in yourself, make sure you do, but also for every one of your patients, because it's incredibly important and has a very good correlation with cardiovascular disease. And these Lp(a) lowering drugs are now being evaluated both with the oligonucleotides, antisense oligonucleotides, as well as small interfering RNAs. The Horizon program is one such program by Novartis where they are looking at pelacarsen, which is an ASO with a very large outcome study that should read out the end of this year. The OCEAN programs is the small interfering RNA for Lp(a) outcome data that should be also reading out in a couple of years from now. Lots and lots of excitement coming down the pike. At last but not least, inflammation and cardiovascular disease. The traditional risk factors are absolutely there, but this emerging inflammation risk factor is one that has to be in front of us. And in fact, we are seeing and noting that high sensitivity C-reactive protein is just as important, but perhaps even more important as a biomarker than LDL in terms of residual risk in PCI. This is from our database, and we now have data from Paul Ritker's group showing very, very similar data. It's this NLRP3 inflammasome and the cascade of the interleukin 1B, 18, IL-6, which then leads to the liver, and we measure the biomarker of C-reactive protein in the end, seeing the important association with vascular risk with elevated high sensitivity C-reactive protein. Do you know what yours is? Measure it, know it, because it is important. Inflammation plays a very relevant role in atherosclerosis, and this chronic activation could be detrimental, and it is associated with worse major adverse cardiovascular events. You remember colchicine, two very important studies, COLCUT and LODOCO-2, both showing a very important reduction in cardiovascular risks with 11,000 patients in 5 randomized clinical trials showing major reduction, and an FDA approval in 2023 for low-dose colchicine. But important, large-scale clinical trial of clear synergy by the McMaster investigators showing absolutely no benefit of colchicine in patients with acute MI undergoing PCI. What is going on here? Is this the end of the inflammation story? And I'd say absolutely not, because we know that in the CANTOS analysis, which was a IL-1 beta inhibition showing reduction in MACE and a dose response with canakinumab, the very important reduction of IL-6 was associated with the best possible clinical outcomes in those patients post-MI. And in fact, we are now addressing this with an IL-6 inhibition called ziltivekimab, and in acute myocardial infarction, acutely and then chronically. And this trial of 10,000 patients with DW Park leading Korea on this trial, the Artemis study, has begun enrollment and has already enrolled over 2,500 STEMI and non-STEMI patients, and continues to get to its 10,000 patients that we will evaluate in terms of this therapy for our patients. And then obesity and cardiovascular disease. How can you walk away without talking about the GLP-1s, right? They are here to stay, and they are working on every part of our bodies. It is not just about losing adiposity, but it is actually in improving myocardium, the plaque, blood vessels, kidney, liver, central nervous system, and the work of SELECT trials showing a huge reduction in primary endpoint on patients with not with diabetes, but with obesity, and showing a very, very important reduction, semaglutide, in pretty much every endpoint you can imagine. And now we have other agents with outcomes trials, and one that was just presented at ACC showing very similar, an oral GLP-1 agonist that also showed a reduction in events. And of course, it isn't just about coronary events. The GLP-1 agonists are also working in peripheral arterial disease, reducing hemoglobin A1C, weight, inflammation, blood pressure, kidney complications, so much, and enhancing in those patients with critical limb ischemia their walking distance by 40 meters. There is a lot to be learned about what we can do for our patients after our interventions, and these therapies are also very, very important. And the future for the next 30 years is incredibly bright, because non-invasive imaging is going to guide us. The role of CCTA is emerging as the one and only place where we can not only make a diagnosis of coronary disease, but better understand plaque morphology and, of course, everything else that's associated with using CT and CT imaging. Not all of these plaques are created equal, and being able to use AI in enabling our CCTA analysis is what Clearly is up to with this very, very important TRANSFORM trial that is coming down the line. And I think this is going to be absolutely revolutionary for us to not only diagnose, but also imagine what kind of plaque each and every one of us have, and very importantly, how to deploy our prevention strategies on each and every one of these patients. And AI is here to stay. It's here. Is it ready for prime time? In certain places, yes, but we are seeing it in every place, and we know that the use of imaging and AI together, there is no limit to what can be predicted, what can be discovered, and what can be diagnosed and treated. And I think this is really, truly the future. And the future is extremely bright, and we know much of it comes from this part of the world. And I feel so lucky to have known you over the last 30 years, to be part of this important meeting. And I want to congratulate you all on this 30th anniversary of TCT 2025. Congratulations. I couldn't be a luckier girl to have been in this cath lab all those years ago. What you taught me will never be forgotten, SJ. Thank you for all of your incredible contributions, and welcome to the 30th anniversary of TCT Asia Pacific 2025. We're all excited for this. Thank you so much.
Thank you very much, Dr. Roxana Mehran, for your outstanding presentation, and congratulations. You give us just the heartfelt moments to everyone. Thank you very much once again.